Depression and anxiety are two prevalent mental health disorders that can have a significant impact on a person's daily life, relationships, and overall well-being.
Yes, that's right. Depression is characterized by feelings of sadness, hopelessness, and a loss of interest in activities one used to enjoy. Anxiety, on the other hand, is characterized by excessive worry, fear, and a feeling of being on edge.
While depression and anxiety have different symptoms, they often occur together. In fact, research suggests that about 50% of people with depression also have an anxiety disorder, and vice versa.
This can make treatment more complex, and it's important for mental health professionals to conduct a thorough assessment to identify both disorders in their patients.
Cognitive behavioral therapy, CBT, is commonly used to treat depression and anxiety. CBT helps individuals identify negative thought patterns and replace them with more positive ones. It can also teach coping strategies and relaxation techniques to manage anxiety symptoms.
In addition to therapy, medication can also be helpful for some individuals. Antidepressants and anti-anxiety medications are commonly used, but it's important to work closely with the healthcare provider to determine the best course of treatment and to monitor for any side effects.
Lifestyle changes can also help manage symptoms of both depression and anxiety. Regular exercise, a healthy diet, and stress management techniques like mindfulness and yoga can be beneficial.
Exposure to extreme heat can have severe consequences on the human body. When the body is exposed to high temperatures, it tries to regulate its temperature through sweating and increasing blood flow to the skin. However, if the body is unable to cool down enough, it can lead to heat exhaustion or even heat stroke, which can be fatal.
Yes, and heat exhaustion can cause symptoms such as heavy sweating, dizziness, nausea, and headaches. If not treated, it can lead to heat stroke, which can cause the body temperature to rise above 104 degrees Fahrenheit, 40 degrees Celsius, and this can cause confusion, seizures, organ failure, and even death.
In addition, exposure to extreme heat can also lead to dehydration, which can cause further health problems such as low blood pressure, rapid heartbeat, and kidney damage.
That's correct. Vulnerable groups such as the elderly, children, pregnant women, and people with certain medical conditions such as heart disease are at greater risk of the harmful effects of extreme heat.
To prevent these effects, it is important to stay hydrated, avoid direct sunlight during the hottest parts of the day, wear loose and lightweight clothing, and seek air-conditioned environments when possible.
Yes, and it's also essential to monitor the symptoms of heat exhaustion, such as heavy sweating, fatigue, and muscle cramps. If someone is experiencing these symptoms, it's important to get them to a cooler place and provide fluids and rest. If the symptoms worsen or if heat stroke is suspected, it's important to seek medical attention immediately.
Honey is a versatile ingredient that has been used for centuries not just as a sweetener, but also as a natural remedy for many health problems. It is rich in antioxidants, vitamins, minerals, and enzymes that promote good health. Can you tell us about some specific health benefits of honey?
Sure, honey has antibacterial and anti-inflammatory properties that help in treating wounds, sore throat, and cough. It can also boost immunity, aid digestion, and soothe the nerves. Honey has a low glycemic index, which means it does not spike blood sugar levels like regular sugar. This makes it a great option for people with diabetes or those looking to reduce their sugar intake.
Wow, those are some impressive benefits. How do you use honey in your recipes?
Honey can be used in both sweet and savory dishes to add a unique flavor and a touch of sweetness. It pairs well with cheeses, fruits, nuts, and spices. I use honey in salad dressings, marinades, glazes, and desserts.
That's great, Chef. Do you have any tips for people who want to incorporate honey into their diet?
Yes, I recommend using raw and organic honey as it contains all the natural enzymes and nutrients. You can also replace sugar with honey in your tea, coffee, and other beverages. And always remember to use honey in moderation as it is still a form of sugar.
Can you tell us about the risks associated with smoking menthol cigarettes?
Well, menthol cigarettes are just as dangerous as regular cigarettes, if not more so. The added menthol flavoring can mask the harshness of tobacco smoke, leading to deeper inhalation and increased exposure to harmful chemicals like carbon monoxide, ammonia, and hydrogen cyanide, all of which can cause cancer, heart disease, and other serious health problems.
Is there any evidence to suggest that menthol cigarettes are more addictive than regular cigarettes?
Yes, studies have shown that menthol cigarettes can be more addictive than regular cigarettes, making it harder for smokers to quit. The menthol flavoring can create a sensation of coolness that can be soothing to the throat and lungs, making it easier for smokers to inhale deeper and more frequently.
Are there any particular groups that are more at risk for smoking menthol cigarettes?
Yes, research has shown that menthol cigarettes are more popular among young people and certain racial and ethnic groups. This has raised concerns about targeted marketing by the tobacco industry, which has long exploited these groups to promote their deadly products.
What do you think should be done to address the issue of menthol cigarettes?
I believe that menthol cigarettes should be banned, as they offer no benefit to smokers.
My current position involves me in the instructional, managing, and guidance domains, which allows me to shape the learning of learners as well as my colleagues. One of the other major tasks that I have taken up is to facilitate professional development workshops. These sessions are aimed at enhancing the knowledge of the teachers and incorporating new methods into the practice. For instance, I recently conducted a training session on differentiation to which we focused on various approaches that can be used to address the needs of the students in class. This not only improved the quality of teaching learning practices offered by the teachers but also developed a positive organizational climate among the faculty members. Mullen and Clematis, 2019. Also, I encouraged professional development by providing coaching to new teachers during one-on-one sessions. These sessions are very crucial to the first years as they aim at managing their classes and helping their students. Anderson and West, 2020. I can recall an instance when I had a new teacher by the name of Sarah who had a serious issue controlling the students' attention. Through the week-to-week communication we were able to develop individual strategies that would help her majorly in lesson plan and class practice, which improved her classroom practice. Mentoring is not only restricted to teachers, but it also concerns students. As a teacher responsible for managing our school debate team, I educate students on how to become better speakers and critical thinkers.